For the next oral presentation entitled High GLP-1R is associated with poor clinical outcomes and metastatic potential of extrahepatic cholangiocarcinoma, presented by Yongyot Varathorn from Faculty of Medicine, Khon Kaen University.
So, good morning, ladies and gentlemen. Today I will be presenting about the association between GLP-1 receptor and the progression of extrahepatic cholangiocarcinoma, presented by Yongyot Varathorn. First of all, I would like to thank my advisor, Professor Jalupong Sanbunmi from the Department of Biochemistry, Faculty of Medicine, Khon Kaen University. First of all, background and rationale. So cholangiocarcinoma is a cancer of bile ducts. There are two types, intrahepatic, which is inside the liver, and extrahepatic, which is outside the liver, which includes peripheral or Klatskin tumor and distal subtypes, with Thailand having the high global prevalence of cholangiocarcinoma, especially in the northeast region, mainly due to the Opisthosis viverrini infection from eating raw cupinoid fish. The prognosis of the disease is very poor, with 5-year survival rate of around 48%, with common symptoms of jaundice, abdominal pain, and indigestion. Next is GLP-1 receptor. It's a G protein coupled receptor found in the pancreas, brain, heart, and GI tract. It increases insulin, decreases glucagon, and increases satiety, and is a target for type 2 diabetes and obesity treatments. There has been studies linking GLP-1 receptor expression to cancer progression and prognosis, with high GLP-1 receptor in intrahepatic cholangiocarcinoma correlating to a better survival rate. So investigating the association between GLP-1 receptor in extrahepatic cholangiocarcinoma may reveal new prognostic markers, potential therapeutic targets, and more personalized treatments for the patients. So our objective is to investigate the association between GLP-1 receptor and the survival of CCA patients, and investigate the association between GLP-1 receptor and clinical pathological characteristics of cholangiocarcinoma patients and the roles of GLP-1 receptor and the cell progression. So our research design is retrospective cohort survival study and in vitro experimental study. Our target population is extrahepatic cholangiocarcinoma patients in the northeast of Thailand who underwent surgery at Srinakalin Hospital, Khon Kaen University. Our method of recruitment is extrahepatic CCA tissues archived at Cholangiocarcinoma Research Institute. Our inclusion criteria is: 1, the tumor tissues were obtained from patient age at least 18 years old to a histologically proven CCA tissues, and extrahepatic CCA diagnosed by a pathologist. So the result is we got 43 patients from the Cholangiocarcinoma Research Institute and the GLP-1 receptor from the immunohistochemistry study using GLP-1 receptor antibody with median H-score 160 and using SPS program as statistical analysis. So the immunohistochemistry we perform on the tissue samples from the Cholangiocarcinoma Research Institute. Specimen will be stained with a primary antibody for GLP-1 receptor proteins, then a secondary antibody to the primary antibody for the amplification of the signals, and lastly, diaminobenzidine will be used to develop the colors of the sample. Then the sample will be measured for H-score through a light microscope, and the survival time, tumor size, metastasis, local lymph node invasion, and vascular invasion will be measured in both groups and compared to each other. For statistical analysis, we'll be using survival analysis for the GLP-1 receptor level and survival time, and Pearson's chi-square test for the GLP-1 receptor level, tumor size, and metastasis and invasion. So here are the results. This is the results of the staining. So the overall survival shows no statistical significance between the high expression and the low expression groups. Next is the Pearson chi-square. So the Pearson chi-square shows that there is an association between the high expression group with mucin production and well differentiation of the tumors. Next is the unit variate classification. So the results show that there is no statistical significance in the clinical pathological characteristics. And lastly is the knockdown of GLP-1 receptor in cell line. It shows that knockdown of GLP-1 receptor does not affect proliferation, but suppress migration and invasion of KKU 100 CCA cell line, and it also suppresses signaling via STAT3 and AKT pathways, leading to downregulation of mesenchymal markers and matrix metalloproteinase. And in summary, the GLP-1 receptor expression is associated with mucin producing type of extrahepatic CCA and well differentiation in extrahepatic CCA. It is not associated with survival outcome, and knockdown of GLP-1 receptor suppresses migration and invasion of extrahepatic CCA cell line by inhibiting STAT3 and AKT pathways, leading to downregulation of proteins functioning in epithelial mesenchymal transition and matrix metalloproteinase.
That was an insightful presentation. Do you have any comments or any questions?
Please show the topic. I need to see your topic. The first part. You change the topic because the topic name is not the same in your slide. The original is the high GLP-1 is associated with the poor clinical outcome and metastatic potential of extrahepatic cholangiocarcinoma. You change topic?
No, I think there might be a typo when in the topic.
Oh, okay. For me, because I reviewed the abstract before, and then based on your result, the GLP-1 was significant associated with the poor pathological outcome, but it's not associated with overall survival. But you change the topic, okay?
My question is about your finding, about the suppression. When would you explain more about the application of this knowledge from your finding?
So from the findings, we show that there is like the tumor with high expression levels has mucin production, which can potentially be used as like a tumor marker.
No,
in
the
patients.
one that can suppress the last one. Yes, yes.
So
do you have any application from this knowledge?
So in clinical application, the patient which has hepatic cholangiocarcinoma can use like the GLP-1 medication that can suppress GLP-1 receptor for a better prognosis, which can inhibit the proliferation and migration of the tumors.
Possible in the future, okay, but it's the point that important finding, and maybe it's something that we can go further for the future research.
Can I ask in the details? What is sample size of this study?
So our calculated sample size is around 400, but we only managed to find about 40 tissue samples currently. So in the future, we are currently recruiting more samples for the next batch of the experiment.
So when you conclude that GLP-1 is significant association, when the sample size is so small, I'm not think that this is a really significant because sometimes it's just an error or bias. And in this study, you have, I think this study is great, but you have two studies in one abstract. The first one is the survival, right? The second one is the biochemical study. And you don't have present the details of your second study. For example, the sample size, how you manage the knockdown, what is the subject that you use, the latch or something like that, or cell line. We don't have the detail of that.
Thank you for the information and the questions. Thank you very much.